social work manager, I would say that probably 90% of the stalled cases, the cases that are either escalating or simply not making progress over a significant period of time, I think that we could look at all these cases and conclude that in most of them, I would say upwards of 90% of them, the underlying issues can almost always be traced to limited insight and entrenched maladaptive behaviors. So that brings us to the idea of assessing insight. Now, from the first assessment that you might do as social workers with a particular child and their family, oftentimes as a social worker I wrote and as a manager I read the phrase limited insight. And oftentimes in the assessment process what we're talking about is that in meeting with the child, the parents, the family, it became clear to me as a social worker that the individual's ability to improve their understanding of their situation was limited in its capacity. Now pair that along with the idea that social workers are traditionally trained based on the notion that if we can just help the person in front of us to understand the thinking and the choices that they're making, if we can accomplish that much, then we're in a much better position to help that individuals to look at those ideas, look at those behaviors, and start the process of facilitating change to relieve the risks that are in place or the negative outcomes that are a result of this thinking and these behaviors. Now, this will work for us as social workers probably 80% of the time, but when we're working with either a child or a family where insight is limited, it seems that we are going over the same material, reviewing and repeating the same actions over and over with no discernible result. So the point to be made here is that when you are working with a case that is particularly complex and challenging, the idea of assessing and reassessing the individual's capacity to improve their insight is key. The bottom line point here is that when you come to the conclusion that the prospect for improved insight is limited or non-existent, well, that's when we have to start thinking as social workers about the need for behavioral intervention. So at this point, I'd like to turn the discussion over to Cormac to talk about ABA, the fundamentals of it, and to impart with you some key tools that you could use in your own practice.
Hi guys, I'm going to talk to you a little bit about ABA as a treatment model. It's a bit bizarre talking to you guys through a screen, but bear with me. So first of all, I think what we'll do is we'll introduce the concept of ABA and talk about some of the core principles that sort of define its approach. And we'll go into a little bit more detail then in terms of particular approaches, and hopefully some situations we talk to then will be relevant to the cases that you're currently working on and supporting with. So as an approach, it's to understand and improve behaviour. As Sal already mentioned, there's 40-50 years of empirical evidence to sort of to back up the core principles and how it is applied. And four main areas really, and if I was asked a question as to how I would sort of define ABA or what the main take-home points are, it's outcome focused. So it's quite an ambitious approach in terms of the strategies that we put in place to teach replacement skills. They need to be meaningful to the young person and meaningful to the sort of the family as well as a whole. That brings us on to sort of socially significant change. It needs to be a meaningful difference. So there's no sense really in teaching an 18-year-old 4 times tables if they can't tie their shoelaces or they can't make a snack for themselves. How do we know if we're actually bringing about socially significant change, and how do we know our outcomes are working? Well, that's through our data. So the third one there, data-driven, it's objective data. So we look at behaviours of interest. We'll talk about that in a bit more detail as we go on. And it's very much individualised. So it's moving away from the idea that one size fits all. We need to understand that as ABA is applied to individuals with quite complex needs, as Sal already mentioned, individuals may be on the spectrum or individuals presenting with complex behavioural needs, requires a much more tailored, person-centred, individualised approach. Two main tenets of ABA. I always say to staff working with young people, there's very little sense in trying to teach something new until you've got the behaviour under control to begin with. So kind of principle number one, and goal number one is to bring about a reduction in challenging or socially undesirable behaviour. And then in tandem, teaching those replacement skills and strategies. In essence, if you just did the first one, it will creep back in eventually. You need to give somebody another way to communicate the same thing. Really, what I want you to take home from today is the fact that any behaviour, whether it's challenging, forms some sort of communication. It's our job to understand what it is that the behaviour is trying to tell us, then put in something to replace that. Some challenging behaviours that you might have come across, certainly we come across as well: aggression, self-injurious behaviour, tantrums, non-compliance. That list could go on all day. But then more importantly then, so once you sort of, let's assume we've dealt with those challenging behaviours, brought them down to a sort of a lower level, more manageable level, you're putting in things to replace those. So whether it's a functional communication system, central to any intervention that we would focus on, it would be on providing the young person with a communication system. Could be verbal, could be gesturing, could be using sign language, pictures, etc. I always use the example, if you go to a foreign country and no one speaks your language, you have to sort of fend for yourself. You could become very frustrating and overwhelming. Make it even worse then if someone put a bandage over your mouth and you weren't able to talk, become very, very distressing entirely, and that's often how our young people feel, an inability to communicate effectively and appropriately to a communicative partner. Focusing on self-help skills again, like I pointed to already, we need to think about social significance. So again, we need to teach someone how to look after themselves before we teach them more complex things. Also applying it in various other ways, you can see yourselves there. So using public transport, operating in the community, learning to learn skills, that's for sort of very early intervention, so in terms of being able to respond to your name, being able to imitate. And then very importantly, how to regulate your behaviour, taking breaks, de-escalating, and so on. So when we think about why challenging behaviour occurs, I've already alluded to the fact that all behaviour occurs for a reason, and all behaviour serves some sort of communicative function. Our job as a behaviour analyst, when we're implementing an ABA program, is to find out why that behaviour occurs. It's very easy to get bogged down in what the behaviour looks like, and I think we are all guilty of focusing on the what's, or the real specifics of an aggressive intervention, or real specifics of when someone strips off in the community. It can be very distressing, etc. But why is that occurring? So looking at the points down there, everything occurs for a reason, and we refer to that as having a function. Our role is to identify what that function is, in other words, what the message behind the behaviour is, and what we develop then is a function-based behavioural intervention. So essentially anything that we're going to do, we need to teach replacement skills that match the same function that the challenging behaviour was serving. We talk through what's called a three-term contingency. It's on the right of your screen. It's A, B, C, the antecedent, the behaviour, the consequence. I'm sure some of you are familiar with that already. Antecedent, as the name suggests, is what's come before the behaviour. And that's really, really important because that helps us identify the triggers. So are there particular people, are there particular situations, particular objects or items in the environment that causes the young person to behave in a way that they're behaving in? The behaviour itself, so that's looking at the what, so what it actually looks like. And the consequence is massively important. So what is maintaining that behaviour? No one, you, me, any young person we work with, is going to keep doing something unless it gives us something back. So to kind of tie that in, the reasons why we're looking at identifying functions is if we know why the behaviour occurs, we can alter our response. Very, very simple example. If we're always working with a child and we realise that every time we present them with a demand, they tantrum on the floor. And as a result of that tantrum, they no longer have to do it. So let's say mum's at home and says to her little lad, oh, I want you to tidy up the plate now. And he'll drop to the floor, start kicking and screaming. And mum says, okay, fine, I'll do it instead. The young lad has learned in that instance that actually if I drop to the floor and tantrum, I'll get out of doing what I'm asked to do, so I'll keep doing that in the future. If we then can identify that's why it's happening, we can say to mum, we can come in and work there directly and say, well, no, in certain instances we need to actually follow through on this. So the young person needs to understand when we ask them to do something, tantruming isn't going to get you out of it. But at the same time, we can't expect a young person to be able to do everything because none of us will feel capable or feel up to doing everything or asked to do it at every one time. We need to give them a replacement skill, usually a form of communication, to say, actually not right now, or can I have a break, or can I do something else? So number one, looking at why the behaviour is occurring, altering our response appropriately so we're not inadvertently reinforcing that behaviour, i.e. actually maintaining it and feeding it. And then number two, most importantly, teaching them something else. Like I said to you earlier on, if you only focus on reducing the behaviour, you're not teaching them anything new. To tie that in then, behaviours only occur if they're being reinforced. That's true to all of us. Have you ever been at a vending machine where you've put in a couple of coins to get your can of Coke out, and every other time up until now it comes out? system works perfectly, and you're at that vending machine, an old creaky one, and it just stays at the edge, doesn't come out. What do? You pound it, you kick it, you shake it, and if it comes out, eureka. Would you normally act and behave in that way? I don't think you would, just in that instance, because up until now, every time you've behaved in that way, something happens. Every time you put the coins in and put in the selection, the can of Coke has come out. But this time, for whatever reason, it hasn't, so you've upped the ante. We need to bear that in mind as well when we're talking about the previous thing here in terms of when we're altering our response. So going back to the example I gave about the young lad on the floor tantruming, it's probably likely the first 2 or 3 times that the therapist or that mum or dad try to follow through, you'll actually see an increase in the amount of behaviours they see. So as well as kicking and shouting, you might have some name calling or some spitting, because they're just upping the ante to think, if I keep going, maybe eventually they'll crack. Our job is not to crack. In terms of reinforcement, we describe reinforcement, it's a consequence that strengthens a behaviour. And when I say strengthen, that means it increases the likelihood of the behaviour occurring again in the future. Think about yourself, think about your own lives. We're all much likely to do something when we're motivated. You're not going to keep working forever if you're not going to get paid. I'm sure in the second one, I've never personally gone on a diet to fit into a wedding dress, but I've heard, you know, if you do it and you fit into a wedding dress, it's well worth the dieting. If you're thirsty, you're going to have a drink. Social things, going to meet friends, going to the gym. If you keep going to the gym day after day after day and you see no decrease in your weight and you see no increase in your fitness levels, you're probably going to end up giving up. Key point here is sometimes we need help to stay motivated and to find motivators. It's a really important one for the young people we work with. Individuals with complex needs may have very limited leisure activities, a very limited leisure repertoire. And constantly focus on, you know, a couple of things like an iPad, going on the laptop, listening to music, just a couple of things. And to vary that is really important because, like anything, too much of anything you get bored of it. If a young person is bored by the 2 or 3 things they enjoy doing, in essence, they're more than likely going to revert back to engaging in inappropriate responding. Key to remember in terms of individualized approach is that we're all motivated by different things. So just because one guy I work with likes the iPad doesn't mean someone else does. Just because someone likes going shopping doesn't mean someone else does. In fact, they could hate it. And remember, to be motivated, we need to know what we do is rewarded by what we put in. That's really important. And I always say this to parents. When we're teaching something new for the first time, this is brand new for the young person. It's going to take a huge amount of effort for them to actually engage in that response. That's a big deal, and we as practitioners need to be really aware of that and up the motivation, up the reward for that. So what we do, we need to match it. If I work 60 hours a week, I want to get paid for 60 hours a week, versus if I work 40 hours a week, I expect to get paid for 40 hours a week. My CEO isn't here, so I won't talk to you about that now. Again, just to reinforce that point, one size does not fit all. ABA is person-centered. It utilizes an individualized approach. Individualized in a number of ways. There are individual skills, there are areas of need, communication systems, interests, and motivation. That quote there, one man's meat, another man's poison. Really and truly, when we're talking about one size fits all and we're talking about an individualized approach, when we go in and we run an assessment on a young person's needs and their skill sets, you know, where they're strong, how they communicate, if we came in without identifying all those individual skills and we came in with a blanket approach, it's very unlikely it's going to work. So I do hear at times of some sort of settings and schools where by the speech and language therapist as an example might suggest that we'll adopt a particular communication system across the school. So let's just say, for argument's sake, it's Makaton. So everyone in the school will teach Makaton too if they're not vocally verbal. That might be effective, but for a lot of young people who mightn't have the fine motor skills, for example, it mightn't be the most effective way to communicate. ABA would argue that we need to individualize that to meet the individual person's needs. If someone's visually very strong, I would recommend that they use a communication system that focuses heavily on visual. So, for example, Picture Exchange Communication System or PECS. If someone is well able to imitate, I would say, well, Makaton might be a really good example then because they'll be able to learn through imitation. Individual interest and motivation, massively important. Again, I've already touched on it. We need to make sure that whatever we're giving the young person as reinforcement actually functions as a reinforcer. I just thought we'd quickly look at a couple of graphs from a case study, and this is to sort of, I suppose, reinforce the point around what the areas of focus are for ABA. I'm going to skip on one slide and come back to that in a second, okay? So firstly, we started working with a young guy, and the graph you're looking at is a graph of physical aggression directed towards staff and directed towards family. And it was occurring at a sort of a modestly high rate, I'd say, to begin with. It was interfering with his learning. So he was unable to sort of contact learning within the school environment. He was unable to sort of interact with his younger sibling at home, or really to be able to interact in a meaningful way with parents. Aggression would sort of be his main go-to. So we did all the things you'd expect us to do as behaviour analysts. We went in and looked at, as we talked about already, why the behaviour is occurring, so identifying the functions by looking at ABCs and three-term contingencies. And once we identified the functions, we then could do two things. The first one, we could adapt our own responses to aggression. So when aggression occurs anymore, you're not going to get what you've been getting up until now because that's been strengthening the behaviour. So then over time, that intervention, as you can see by the downward trend, that led to a decrease in the need for the young man to engage in aggression. However, if we taught that in isolation and nothing else, it's probably likely you'll start seeing spikes again, which brings us back to the idea of teaching replacement skills. Really simple things here. This is a young person. This is someone who's 5, 6 years of age. Obviously, if it's a teenager, it'll be very different targets you're targeting because, again, it's a very individualized approach to teaching and learning. But simple things, learning how to request an item, such a simple skill, but actually in the absence of having that, what's going to happen? You're going to have someone who's going to be grabbing it, yanking it off a brother and so on. Functional communication, so no, more, not ready, 1 more minute, all those sorts of things. Being able to initiate play requests, he had none of that repertoire to begin with. Something we're looking at targeting them because ultimately sometimes I actually want to play, but I know the only way I'll get your attention is by dropping to the floor and kicking my younger brother. So actually we're teaching you don't have to do any of those things anymore. What's really important, I think, to bear in mind when we talk to families about this is that, think about the vending machine example again. Sometimes behaviours temporarily will get worse before they get better. And we need to be aware of that. And I often say to parents that actually that's a sign that learning is occurring because the young person is seeing that everything in my repertoire, all the things in my tool set aren't actually going to work for me anymore. And what are they doing in that stage when they're really, really upset? They're asking you, tell me what I need to do. So it's your job then as a behaviour analyst, it's your job as a practitioner, mum and dad's job to give them those tools to communicate appropriately. I'm going to try and tie that in then. So just to kind of go through that point by point, as Sal mentioned to begin with, we need to look at insight-driven approaches, and in situations, in cases that you might have as practitioners where you feel that insight is lacking or non-existent, as Sal alluded to already, is a behavioural approach going to complement that? ABA isn't going to work for every single case you work on, and we don't think for a second that it should or would. But what's important to be aware of is that at times, as Sal mentioned, when cases have stalled, it's important to have something else in your toolkit. And to be able to allude to a behavioural approach that looks at, well, why are the behaviours occurring? How can we teach something new? How can we increase their motivation? That will then lead to them being more on task. That will hopefully increase mum and dad's ability to engage with them. Is that then, over time, going to perhaps increase mum and dad's ability to have that insight that's necessary to make the next steps as practitioners? Think about the behaviours. So again, focus less on what the behaviours look like. It's no doubt that when we talk to parents about the behaviours, in essence, it's what it looks like, and you know how stressful it can be, and how physically, emotionally, psychologically draining it can be, and 100% we would agree with that. However, we can get too bogged down in that side of things and focus then less on why the behaviours are occurring, which brings you on to the antecedents. So what's happened just before the behaviour? That isn't going to tell us every single time, and you'll often hear parents saying it happened out of the blue, and you know what? Sometimes that's probably true. But the idea as behaviour analysts is because we take data on a daily basis, every time we run session we take data on behaviours that occur. Data will then show a trend. It's very easy to say, I feel like last month he was behaving this way and now he's behaving that way. That might be accurate, but it's very likely that there's going to be a lot of inaccuracies in that sort of recall, because I personally can't remember what I had for dinner a month ago, never mind, 2 months ago, etc. Focus on why the behaviours are occurring. It can only come from building up a picture parents, with carers and so on, about what's preceded them, so the antecedents, and what's followed the behaviour function. So very simple questions. So what happens after the young person engages that behaviour? Or what has come before it? What were you doing? What was he doing? Were you busy? Were you on the phone, for example? Oftentimes I talk to parents, and actually when they phone me up, ironically, to sort of talk about support, etc., you can hear the little person they're phoning about in the background kicking and screaming, and mum and dad will invariably say, oh, it's because I'm on the phone, for example. So again, young person's trying to get attention and doesn't have the ability to communicate that more appropriately, and doesn't have the coping mechanisms yet in terms of being able to regulate their behaviour to wait. consider the substitutions. Considering what skills we're actually going to teach, hugely important. We can find out why the behaviour occurs, we can match those responses, we can ensure that those behaviours aren't reinforced anymore, fantastic. But in isolation, that's only going to get you so far. The really important thing is putting in those replacement skills, and honestly, 99 times out of 100, the first thing you'll think about is the communication system. Is the communication system working? And that means really working. It's not a tokenistic textbook that's living in a drawer in the house, or not mum and dad who have a couple of signs but actually aren't anywhere near up to speed with school. Think about it, if someone's been able to communicate in 30, 40 different ways in a school environment, they come home and actually only 3 or 4 of those signs are understood by that person, you're going to become frustrated. So it's important that there's consistency and collaboration across professionals involved in the young person's life. And how are we going to know something's working or not? How are we going to know why behaviour occurs? It's going to be on our data collection systems. Very, very simple things. ABCs will show us why behaviours occur. If are things increasing, are things decreasing? Other important things sometimes is it a particular time of day. That might give you an insight into perhaps maybe a routine needs to be changed. Maybe it's an internal thing that you need to look at. Maybe if someone's being administered medication, maybe the medication is starting to wear off or it's kicking in, and that can have all sorts of internal effects that we're not actually aware of. So those sort of things can give us a real insight into why behaviours occur and what we can do with that knowledge then to teach functional replacement strategies. I'm going to pass you back over to Sal now, who's going to just wrap up what we've talked about. I hope it was useful. After that, then Sal's going to pass over to yourselves for some questions. Thank you very much.
Okay, what I'd like to move to here at this point of the presentation is that the reality, particularly when thinking about what caseload levels are for you guys these days, and all the other responsibilities, obligations, meetings, conferences, court work that you have to do, the reality is that while the tools that Cormac alluded to that can certainly help your interventions with the clients that you're working with now, there are times when the needs of the child and the family are just beyond what you as social workers can provide. And oftentimes these cases remain stuck due to your inability to be there as often as you need to be in respect to the child's behavioral presentations. And the reality that so often it seems like 20% of our clients monopolize about 80% of our time and attention. Okay. Now, BEAM can provide an intensive application of the ABA model for very select cases, the cases where there's a great deal of concern with the level of stuckness, if you will, the how long a family or the case itself has remained in a static position with the risks to the children remaining at a high level that is just certainly uncomfortable for you as the allocated social worker. So we certainly would like you to keep us in mind as far as that is concerned. We are also always available to discuss cases with you either over the phone or in person. This is a free service that we offer. It's an opportunity for BEAM to get to know you and your local authority better, and oftentimes these cases result in us just giving you advice that you can bring back to your casework and see what kind of results you can get from that. Sometimes our discussions do result in referrals, and that's certainly a good thing in the sense that you now have a resource that can be in the home working these ideas, these concepts, these strategies with the frequency that is required for the particularly challenging and difficult cases in order to facilitate movement towards the objectives that you're looking for your cases. Okay, at this point, I believe that we do have some questions, so what I will do is hand back to Cormac to give you clinical feedback on the questions that you're presenting to us.
Okay, I've got a couple of questions here. I'll just pick them in order. I'll just go, whatever information's here, we'll go from that then. Someone's written in that they're with a young boy who doesn't communicate, lots of challenging behaviour, and would this therapy, would it work? I I think that's probably what we've been talking about, is that I would probably argue the young boy does actually communicate. He's probably just communicating at the moment in quite an inappropriate or socially unacceptable way. So you say there's like lots of challenging behaviour, whatever that might be. I suspect that's actually the young guy's current mode of communication. What I would do, I'm presuming maybe you're a practitioner. I presume the next steps would be to look at where else the young guy is. So, for example, if he's in a school setting, looking at how they're communicating there, if it's simply just challenging behaviour as well, or if there's another more socially acceptable mode. Because at times you'll see, we didn't touch on it because we didn't have enough time, but a huge part of ABA is about generalization, and oftentimes you'll see that young people with sort of complex needs, autism in particular, find it very difficult to generalize. And we talk about generalization across people, across locations, and across time. So I'm sure you've always heard the thing where he's good as gold in school, when he comes home he's a holy terror. Again, it's because the young person perhaps isn't learning to generalize the skills he's learning in school at home. So I would suggest probably talking to the school first of all to see what modes of communication the young person uses there, and then again, like we talked about earlier on, looking at why the behaviour is occurring. So okay, it's serving a communication function, but what function is that? So do they want to access something? Do they want attention? Do they just want to get out of doing something? Once we can identify that, then hopefully that'll give us a much better way of teaching him, a new communication system. And when you're thinking about that, I would look at if there's speech and language therapy input, for example, and any practitioners in school, anyone else in the young person's life who might have input. If the young person is particularly strong, let's say he's making no vocalizations at the moment, it doesn't really say here if he's verbal or non-verbal, but if he was making no vocalizations, then I would suspect starting out at speech might be very difficult to do. You'd put in something else to begin with. So like I mentioned earlier, maybe something around a picture exchange system, or Makaton, or communication book, or even iPads now have a whole host of different ways to communicate. Looking at what works for him, what's in his skill set already. So thank you for that. There's a few more here. There's one about, a second, I'm just reading for the first time now myself, guys, so forgive me. I work with a family and their son doesn't seem to be motivated by anything. What would you advise? Okay, that's kind of a common enough issue, to be honest with you. Lots of different things. I would really, again, I'd probably argue against, I would say something is certainly motivating the young person, because I'm sure they're behaving in some way, shape or form, acceptably or unacceptably, and that motivates them. And a motivation could be something simple as not wanting to be around other people, so wanting your own time, wanting your own space and so on. Or it could be, those sort of things. I'm sure there's something that motivates, but more generally to your question, what would I advise? I would, again, as I would say to the previous question, I would look at the young person in different contexts, different environments, first of all. If you're a practitioner as well, maybe you've only seen the young person at home. Again, seeing what they do in school. If they're on task in school across the day, I suspect they're motivated by something. So they're not going to, get through school 9 to 3:30 or 9 to 4 unless they're actually getting something out of it. I don't know what age the young person is. So, but anyway, either way, if they're in a school or a nursery setting, and if they're sort of staying on task for a period of time, then something is motivating them. So again, I would certainly advise talk to other professionals working directly with the young person, and then suggesting to mum and dad or whoever's at home or whoever's kind of works with the young person, mix it up. I think we sometimes can become very rigid as practitioners and as sort of parents and caregivers. We will think, well, he only likes doing this and this, so we'll do this and this. Maybe it's worth, really mixing it up and looking at other things, being a little bit creative, being a bit silly, I suppose, sometimes. Just going out of your own comfort zone as well, because you never know what you might strike that will actually motivate the young person. I hope that kind of partly answered your question. Needless to say, as Sal's already mentioned, if there's more follow-ups, you can contact us at our contact details are there on screen, and you can follow up with us. We're happy to sort of get back to you in more detail or more depth. There's one more I see here. How can you tell why a behaviour happens? So that really goes back to sort of functions we talked about earlier. And again, that's just to reinforce that point. That's looking at what's come beforehand, so the antecedent we've talked about already that identifies the triggers, and what comes afterwards, the consequence, so what's strengthening the behaviour. Again, bear in mind that don't base it on one example. One example could be completely out of context. We can all do wacky things once in a blue moon. It's about over time what the general trends are, And again, it's about asking the parents you work with to be sort of reflective, to take the emotion out of things, I think, a little bit, because I think if we can get too bogged down again what the behaviour looks like and too bogged down in sort of inferring what what we feel the person was sort of trying to achieve with it, etc., we might lose the actual meaning of the behaviour. And it's our role as practitioners to sort of find out why behaviours are occurring, and so that we need to be very objective. That's all the questions I seem to have through, so I'm going to put you out of your misery soon and leave you off. Just a couple of things I want to sort of close on, just to make you aware that Sal touched on it already, but one of the things that we as a service provider are providing to some local authorities already within London is some free training. It's very much customized. So essentially what we've done with some local authorities already is we've met team managers, we've met social workers, staff kind of working day in, day out in the family homes about what's important to them. So for example, we're talking to a couple of local authorities at the moment who want us to present a little bit more on the idea of sort of, the functions of behaviour. It's a very simple example. But what we're doing currently with local authorities is talking to them about what will be meaningful to you and your team. Do you feel that actually we want to empower the social workers naturally to give them more skills in their skill set? So in essence, what we're kind of saying at the moment is if you feel that you might benefit from this training, which again is free, it's free consultation and training, feel free to get in touch with us. Our contact details are there. We'd be more than happy to speak with you, maybe set up an initial meeting to kind of sit down and look at what your needs are as a provider. Currently figuring out, the areas that you think your staff would sort of benefit from a kind of a behavioural approach. And that's pretty much all from us. I'd like to thank Sal for all of his insight, and I'd like to thank you all as well for your time. We'll send this around as a follow-up, so you'll have a copy of the slides and the content that we share with you today. Again, just to reinforce the point, feel free to get in contact with us to the means that are on your screen now if you have any further follow-up or questions. Thank you and have a good afternoon.